Hello friends, today I am going to talk about number needed to treat analysis. Number needed to treat is the number of patients you need to treat to prevent one additional bad outcome. Bad outcome can be death, stroke or any other serious complication. For example, if a drug has a number needed to treat of 5, it means that you have to treat 5 different people with the drug to prevent one additional bad outcome. Number needed to treat is an epidemiological measure used in communicating the effectiveness of a healthcare intervention, mostly treatment. Ideal number needed to treat is 1, where everyone improves with the treatment and no one improves with the control. Higher the number needed to treat, the less effective the treatment is. It can be used to help us choose between two treatment options. For example, if number needed to treat for drug A is lower than that for drug B, it suggests that drug A is more effective, if all other things being equal. Choosing A rather than B would make sense. It's a useful summary of trial results that is easy to interpret and easy to explain. It is relatively easy to calculate also. Now we can see how the calculation is done. So in this example, there are two groups, experimental groups and a control group. Among experimental group, out of 100, 30 got failure and 70 got success. Among control group, out of 100, 40 got failure and 60 got success. So control event rate is the first one to calculate. Control event rate is the rate of adverse event, in this case failure, among controls. So that is 40 out of 100, that is 40% or 0.4. Experimental event rate, that is a rate of adverse event or failure among experimental group. Here among experimental group, 30 failure out of 100. So experimental event rate is 30 out of 100, that is 0.3 or 30%. Now we need to calculate absolute risk reduction. How much risk is reduced because of treatment? That means compared to controls, how much adverse event is reduced in experimental group. So how we can calculate? That is control event rate minus experimental event rate. That is 40% minus 30%. That is 10% or 0.3 is the absolute risk reduction. Now we have to calculate relative risk reduction. Relative risk reduction is control event rate minus experimental event rate divided by control event rate. That means how much percentage of control event rate is reduced because of experiment. So relative risk reduction is 0.4 minus 0.3 divided by 0.4, or in other terms 40%, that is a control event rate, minus 30%, that is experimental event rate, divided by 40%. That means 0.1 divided by 0.4, that is 0.25. That means 25% of control event rate is reduced because of the treatment. Now we can go to calculation of number needed to treat. Number needed to treat is calculated simply by 1 divided by absolute risk reduction. 1 divided by absolute risk reduction is 10% or 0.1. 1 divided by 0.1 is 10. So how to interpret? Here we got number needed to treat is 10. That means you have to treat 10 people with the experiment to prevent one additional failure or one additional adverse event. Hope you understood. Thank you.